Welcome to Vet Candy, where we talk about the hottest vet news. Thanks for joining us today. We are super excited to be here. I'm Dr. Michelle Moyal, an assistant clinical professor here at the College of Veterinary Medicine at Cornell University, and my focus is primary care surgery.
And I'm Patrick Carney. I'm an internist, epidemiologist, and I'm also an assistant professor at Cornell. My teaching focus is in primary care.
On this episode, we want to know the answer to this huge question. Do our clients get us?
One in two dog parks have worms? Interceptor Plus is a monthly chew that protects your dog from not only heartworm disease, but all 5 major worms. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Now, Patrick, you heard me mention before that a lot of clients and customers seem to be unsatisfied. And actually, according to the American Customer Satisfaction Index, overall customer satisfaction in the US is at an all-time low. Now, this decline began before the advent of COVID-19, but the pandemic has certainly accelerated and deepened it. So how do we connect with our clients and give their pets the best care? How do we make sure that these parents understand how important preventative care is and protection for their patients, for their animals?
Yeah, I think a lot of it goes back to communication, making sure you have really effective communication skills. And one of the things we struggled with in the pandemic is that suddenly all communication went onto the phone and you lose all of those nonverbal cues. We saw that our veterinary students had a year in the clinics where they didn't actually get to speak to people in person. And I think a lot of us are a little bit rusty there. So really trying to go back to learning how to talk to people is going to be important for improving client satisfaction.
Absolutely. Now, I'm a talker. You may or may not have caught that. And so the question is, though, am I speaking the same language? And I mean that as far as generationally. So
Sure.
We know, because we're seeing, students come up through our ranks, that the generations certainly change how we communicate. So let's talk about this. I mean, millennials, like 32% of our pet owners are millennials, and over 70% of millennials, 75% own pets? That's incredible.
Yeah, they're the single largest block of pet owners generationally out there these days. So for somebody like me who's not a millennial, learning how to communicate effectively with them and learning what kinds of things work best to communicate with them is going to be really important.
I agree. So I may have, polled some millennials that I know, and it seems that a high-tech approach is the way to go. They want apps. They want access to making appointments online. They want to order medications online. They really don't want to talk, actually.
Yeah, I've seen that as well. One of the challenges of that is going to be that our second biggest group of pet owners are boomers, so 29% compared to 32%. So not too far behind the millennials, and they speak a very different language. And a lot of the online modalities aren't going to work as effectively for them. So I think as a profession, we're going to have to start juggling. We communicate differently for different people and offer different modes of communication.
100%. So essentially, we think that as new veterinarians, as we see our class of 22 is graduating, they're getting ready to go into practice, or they eventually want to own practices, are thinking very much generationally with those apps and things and making it easy. But for those boomers, right? And older, right? Like my parents who don't even have a computer, the phone has to be an option. So like our customer service face still has to be super strong.
Right. And I think that's a challenge to our front end staff. They really have to have multiple balls in the air trying to keep track of who likes to communicate via phone, who likes a text. I know my own mother, if we communicate via text or email, which is kind of the standard for our practice, well, she checks her email once a month and she's never heard of a text. So she's going to miss everything we try to communicate with her.
Absolutely. And that includes reminders for vaccines, reminders to get more preventative. Remember, Prevention, super important with our patients. And so the goal is to make sure that they understand or explained appropriately what they need. Now my question is, if we're hiring staff that may be a little bit younger, how do we make sure that they talk to those people in an older age range appropriately?
Yeah, that's going to be another challenge. I think we should leverage their ability to talk to their own generation. But
Great
potentially
idea.
we do things like have staff meetings and talk about how people of different generations communicate, and maybe even do things like role play. As much as role playing makes me incredibly uncomfortable, I think it has a role in helping people understand different modes of communication.
I 100% agree. And I force the students to go through that as well. And it sometimes is really a challenge. And so, what I wanted to make sure we understand is, millennials now truly thinking of themselves as pet parents, and maybe an older generation not necessarily thinking of themselves as pet parents. And this is really tough for some of us who are younger doctors. I say that, but I'm not. Might say to someone like, look at your little like furry baby, right? And someone might be like, this is my dog. And so this can get really challenging for people.
Absolutely. Some people are going to be offended when you refer to it as their child, and some people are going to get offended if you call it their pet. So it's navigating really dangerous waters in some respects.
Veterinarians, all of us, do a great job. It's not easy.
It is not easy.
So Patrick, I kind of wanted to revisit this, with our goal to communicate with a large amount of pet owners, namely the millennial population, right? And I know I mentioned apps and making sure they have access to your clinic through apps, but what I really wanted to talk about was social media. Like, I'm gonna admit it, I feel kind of hip. I have Instagram. She said hip, she's not hip. I have Instagram, and I'm on LinkedIn and I'm on Facebook. But it could be a quandary sometimes with social media, right? Like, we want to be available on social media. I know a lot of vet hospitals take advantage of putting their hospital on Facebook.
Mm-hmm.
Then we're subject to reviews, right? Facebook does allow reviews. And comments on our wall if you haven't taken that down. So for someone who's not familiar with social media, they might not be apt to use social media. And these millennials are looking for social media for access to their practice and access to information.
Absolutely.
Right? Veterinarians use it for a source of information, Dental Health Month, all of these like really unique things. And so I think it's definitely something we can utilize, but it's also a little bit scary.
It is. I think for particularly a generation that's not grown up with social media, it can be really challenging. I have to admit, in this discussion, I am a bit of a fraud in that I don't have a Facebook account, I don't have an Instagram, I'm not on LinkedIn. So it's probably a good thing that I'm in academia. But if you really want to connect with an audience, that's the best place to put it out there. And particularly with a lot of the preventive health topics, those can be parceled out as kind of attractive bite-sized chunks that are perfect for social media. So really leveraging that to get messaging across, and then that's going to free up more time in the appointment room to talk about things specific to that pet.
100%. And I mean, there are companies who would actually, you can actually hire that will put that information up for you at a timely manner, which is really neat. I'm one who likes to post my own content, and on Instagram, I try to post some things. But even LinkedIn I think is a fabulous resource, and our students are using it like crazy.
Absolutely.
They're really impressive. But again, I think it's an age thing. I didn't get a LinkedIn until maybe like 7 years ago.
I think one of the really interesting things has kind of been the progression I've seen in terms of professionalism of outward presentation. So 5-10 years ago, a lot of the students were putting things on social media that when they're looking for employment may not have been the best to have put out there. And now when I look at what the students have online, it is very well polished, very well curated. And I think there's been a good shift towards making sure that the presentation is really professional.
Super smart. And I do think that they could use it to their advantage, because I have to tell you, the majority of us will look someone up before we talk to them, visit their hospital, become employed by them. And so it is interesting to look up a website and say, oh, it's not there.
Absolutely. I have to admit, when I get a referral the first thing I do if I've not heard of the hospital before is try to figure out what the practice is about, who the doctors are. And if I can't find a website, that always makes me, I don't want to say uncomfortable, just I really want to get that information. And I imagine a lot of clients want that easy ability to see who they're going to be talking to before they ever make an appointment. So
not only advantageous to the clients, but advantageous to referral practitioners as well.
Absolutely.
Super valuable for your practice. And when I was a general practitioner, that relationship that I built with our local specialty hospital was super important to me. And
Yes.
so, meeting the team online was really part of that. Maybe I spoke to someone, sometimes I would speak to a specialist like once a week, every week. Mm-hmm. And so it was really nice to see a face, like put a face to a name.
Absolutely. And the practices where I felt like I established the best relationship, I think not coincidentally often had one of the strongest online presences.
That's super interesting.
So Michelle, the topic of this episode is, do our clients get us? But I think that may be the wrong question. Vet med is the whitest profession, but half of the US population growth in the past decade has been Latino, and over 40% of Americans are non-white. So do we as a profession get our clients?
That's a great question and a super important point. And as a first-generation American myself, really relatable. We're serving clients who may come into a room and not speak English, or English is a second language and they're struggling with it. Obviously, there are a lot of cultural differences, and we could talk about some of those because, of course, I've seen them during my career. I'm sure you have as well. And sometimes you don't have anyone at your practice to help you negotiate or navigate communication with these clients that you really need to talk about important things with. And so I really want to stress the fact that we have to figure out how we can get our clients.
Yes. A lot of what we've talked about has been kind of generational differences, but we're starting to see veterinarians of the millennial generation. We're seeing technicians from younger generations. So I feel like we're kind of gradually moving in that direction, but we're still stubbornly a very white profession. And I think cultural competency is something that very many of us are missing and will help us really understand our clientele and be able to help them better.
Absolutely. And so what I would say is there are some really nice options nowadays for continuing education to focus on diversity and some challenges that non-white populations face. The other thing is, in practice, sometimes I had a really tough time if I had no one in the building that could translate. I've used Google Translate. Mm-hmm. I'm not gonna lie, I tried to do anything to make sure that the client understood everything. Luckily for us, we had, let's say if I had a Spanish-speaking client, I had some lovely Spanish-speaking technicians, and they would graciously be pulled away from their work to help translate. But again, the goal is not to burden those techs with always being translators, but at the same time, it was incredibly helpful.
Right. Right. So I think trying to make sure that our profession starts to reflect the diversity out there is really imperative for growing as a profession.
Do you know what's really neat? Actually, I just recently found out that even some of our pharmaceutical manufacturers will include inserts in other languages like Spanish. So veterinarians can just request that, which is pretty awesome.
That's a great untapped resource.
I know. It's free, it sounds like. Like it's just, part of the insert that you would give in English anyhow.
Right?
And so I do agree with making it also, when we're talking about really complex topics, really making it seem, or really explaining it as simple as possible. So when I talk with the students, they are to write their discharge instructions in lay terms. So with people who are, have English as a second language, they can't be looking up really complex words with 17 syllables.
Absolutely. And that's a hard unlearning process. They've just spent the better part of 3.5 years learning how to talk like a doctor, and then you have to unlearn that. And it sounds simpler than it turns out to be in practice. And I've fallen prey to this myself. I had a student in an exam room trying to explain chronic kidney disease to a client. And I was watching, and it was clear that the client wasn't really getting it. So I decided to come in and straighten my jacket and, don't worry, I've got this. And I explained in very simple terms what chronic kidney disease was. And the client listened very intently. And then at the end, and she's a school teacher, but at the end, she stopped me and said, "What's a kidney?" And I realized that we often assume a level of understanding that just may not be there. So take some time to get to know your clients, take some time to get a sense of what their level of understanding is, and then you're better able to communicate at a level that they're going to engage with.
100%. And that's another thing I talk about. Sometimes we just take things for granted, right? Like anatomy. We think for some reason we just expect, if we use easier terms that the client knows everything else. And that's just not the case. And the other thing I think we fight is just cultural differences.
Absolutely.
My parents, I have to tell you, when I talk to my parents about, seeing patients or bringing my own animal in to be seen, they're like, what? That's expensive. Like in our country, like they were living in the street and they ate garbage and it was just fine. Like, I don't understand all of this. Like they think it's too fancy. But the truth is sometimes as veterinarians, and whether or not we mean it, we have like an unintentional bias or judgment on what people do with their pets.
Absolutely. I see that really commonly in the neutering conversations that we have with clients. So I really feel that there's this kind of knee-jerk reaction in veterinarians. If you see an unneutered male dog walk in, all of us just want to chop him off, right? And there's implied judgment on the client's behalf as well, that they don't take good care of their animal because they've left it intact. And there are plenty of reasons that somebody would have an intact male dog, but we jump right to kind of worst case scenarios in some instances. And there's a lot of cultural baggage that comes along with something like neutering. So we often just don't realize that that's in play.
Absolutely. And I'm sure you've been on the end when someone has said, there's a dog here, it's not neutered.
No, every day.
Right? And I've been the same. And you know what? I'll readily admit, I was one of the people years ago that was like, what? Don't they know better? Right? And one, maybe they don't happen to know. Maybe they didn't receive that information. Maybe you're going to be the person that imparts that information. But two, maybe it's something that they see no issue with. A lot of countries don't spay and neuter routinely. It's only done for medical reasons.
Right.
And so this is a very interesting topic when we talk with our students here based in the US. When I talk to them about other countries not spaying and neutering, it's only done for medical reasons. They're in shock.
Yes.
Right? And maybe some of these cultures are ahead of their time because, they're coming out with some studies. We've been talking about some of these studies for the last few years on, delaying spaying and neutering in some breeds. And we won't get into that talk. It gets very complicated. So maybe they were just ahead of the studies, saying maybe they would pause and allow their pets to grow a little bit longer. But either way, and regardless of their reasoning, I think it's just something we need to understand.
Yeah, and we need to be willing to kind of engage non-judgmentally when it's something that may go against the way we were trained. So it comes back to opening up a dialogue and making sure that you're really trying to engage with the person where they are.
Yes, and not becoming combative when they say that maybe just isn't for them.
Absolutely.
So Patrick, we covered a lot of content in this episode. Do our clients get us? We spoke about generational differences and talking to our clients that have the majority of pets, which right now for us is millennials, but we can't forget about boomers, or Gen X and Gen Y and Z and all of us. We also spoke about the really important point that we need to get our clients and making sure that we account for our cultural differences and language barriers and work with our clients to get their pets the best care they can get.
Yeah, and it's not just good for our pets, it's not just good for our clients, it's actually good for the bottom line. So at the beginning you had mentioned that customer service satisfaction survey, and it turns out that companies that have high scores on that tend to outperform other companies by a factor of about 2 to 1.
Amazing. Well, that's it for us in this episode of Vet Candy. I'm Michelle Moyal.
And I'm Patrick Carney.
And thanks so much for watching.
Not all preventatives protect your dog from heartworm disease and all 5 major worms, leaving a gap in their coverage. Close the gap with Interceptor Plus. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Hi, I'm Shannon Gregoire, and welcome to Vet Candy, the destination for everything vet med. Launched in 2019, Vet Candy has grown from a weekly email newsletter into a modern veterinary lifestyle brand and an indispensable resource for the best veterinary education. Let me show you around our website, myvetcandy.com, and show you how to keep up with everything vet med. First, let's check out our homepage. We have some great stories to keep you up to date on the latest clinical updates, scientific news, and expert lifestyle tips. We also celebrate amazing people who are making our world a better place. This is my favorite part. For those of you that are looking for exciting veterinary CE, look no further. We have some great stuff for you, and I promise, no PowerPoints and no webinars because we do things differently. Maybe that's why we have more than 1 million views. Now let's go to CE On Demand. Here you will find videos that are all race, New York State, and CPD approved for veterinary education credits. VetCandy is the streaming platform where veterinary professionals can learn from the world's most exciting experts and top influencers. Stream anywhere, anytime, and at your own pace. What I love most is that our videos are studio quality, shot and edited in 4K so you can stream them in 1080p. And best of all, VetCandy's entire collection of more than 75 continuing education videos can be streamed anywhere, anytime, for free. And you can also select up to 12 different languages to watch them by selecting the language of your choice in the subtitles. So, how do you get your CE credit after watching an eligible video? It's simple. All you need to do is watch the video and then pass the quiz. Click on the Take Quiz button. This is the button below the video that takes you to an online test. When you pass the quiz, you will instantly receive an email with a PDF with your certificate of completion. It really is that easy. Next, we have a variety of VetCandy original shows, from talk shows to rounds and games. There's something for everyone, and we are committed to bringing in diverse voices and unique perspectives. Let's look at our master courses. We have 4 master courses right now, and more are coming soon. We have ophthalmology, which is taught by veterinary ophthalmologist Dr. DJ Heusler, toxicology, taught by criticalist Dr. Carrie Hemmelgarn, surgery, taught by board-certified veterinary surgeon Dr. Philippa Pavia, and respiratory disease, which is taught by Dr. Anthony Gonzalez. For our master courses, there are 8 modules for each course. Watch each module and then click on the link that says Take Quiz, and it will take you to an online quiz. When you pass the quiz, you will receive your certificate of completion of the course, plus a link to download some tools to help you celebrate and share your accomplishments. You just click on that link and it takes you to the tools. So that's it for the tour of VetCandy. I hope you enjoyed it, and thank you for watching.